Good morning, class. My name is Andrea Williams. I'm currently a master's student attending California State University of Northridge in their Communication Science and Disorders Systems Program, Cohort 10. Today, I would like to introduce and discuss oral placement therapy techniques and the tools designed to help a therapist implement the different techniques. Sarah Rosenfeld-Johnson created Talk Tools and developed a series of user-friendly products to correspond with her hierarchy approach to oral placement therapy. These techniques help serve individuals with speech, oral placement, and feeding disorders. Oral placement therapy is used when a client cannot produce a standard speech sound using the traditional approaches, which rely on look at me, listen to me, and say what I say, the imitation therapy technique. Oral placement therapy adds the tactile component or the feel of speech. Talk Tools, unique therapy tools, are used to teach articulatory awareness, placement, and muscle memory. Once the client is able to produce the required placement for a sound, then the speech sound is immediately introduced along with traditional interventions. The oral placement therapy is a tactile teaching technique to improve oral motor skills for all ages and all ability levels. This type of oral motor therapy is used for individuals with articulation disorders, whether it be muscle-based, phonological-based, developmental delay, or anapraxia of speech, voice disorders, fluency disorders, and post-CVA clients, as well as clients with mild to profound levels of hearing loss. The tactile component is to help improve muscle awareness, muscle placement, muscle strength, and motor memory, which are all prerequisites for the development of speech clarity. The different exercises that Sarah Rosenfeld-Johnson created target the strength and awareness of the lips, the tongue, the soft palate, and the jaw. There are different exercises which target the different oral motor skills. For example, the horn therapy, the bubble blowing therapy, and the kazoo are all beneficial and utilized for phonation therapy, whereas bite block and gum chewing exercises are used for jaw therapy. Tongue depressor exercises are used for improved lip closure. The tongue tip up and down or lateralization exercises are used for tongue therapy, and that's like this. Those are a few of the tongue exercises for tongue therapy. One of the therapy techniques that I would like to discuss with you is the straw therapy technique, which is helpful with improving the functioning of the jaw, the lips, and the tongue. Some of the specific goals relate to the following: lip rounding, base of tongue retraction, strengthening facial muscles, jaw stability, and improved overall independent self-feeding. With straw therapy, there are a few rules a therapist or parents must follow. At all times, there is no biting the straw with teeth or with lip-covered teeth. Only puckered, rounded lips are to be on the straw tip at all times. If the straw has a lip lock on it, such as a cork or a rubber band, do not remove or move the lip lock. Only the speech therapist moves the lip lock. What is a lip lock, you may say? A lip lock is a rubber band that stops the client from putting too much of the straw into his or her mouth. The speech therapist or parent will have to help the child or the client center the straw in the middle of their lips. Younger children may need help learning to hold the straw for themselves independently. Younger children might have less spills if the liquids are placed in a plastic sports bottle with a straw opening. Simply place a therapy straw into the container for easier holding and less spills. Once your child is able to successfully draw all thin liquids with the first assigned straw, then a new straw will be sent home, and the child may move on to step 2, to step 3, and so on. There's multiple steps with the straw therapy. The first straw is a straight straw with a lip lock, and the next 2 steps use the same exact straw with a shorter straw tip. So this is the first straw. The characters are different, but this is the lip lock that they have, and the straw's already been cut down. So it starts off big, and then when the client places his or her lip on the straw for the first time, then it gets cut. And then they use that for a week, and then they bring it back. Therapist cuts it again. So that's the first 3 steps, is with the straight straw with the lip lock. Step 4 then goes on to using a 2-curved straw. That's straw number 2. I don't have one, but it does 2 curves. As the client moves up in steps, then the straws become more intricate, and the client then begins to perform single draw and swallow techniques. So as they become more intricate, the straws, I have a few of them with me. I don't have all of them. This would be, so after the 2-curved straw, that's straw number 2, comes straw number 3. This one has not been cut. You can see the long straw tip. This is straw number 3. Straw number 4 is the 3-circle straw. Alright. And then single sips or repetitive sips are allowed until completion of straw number 4, which is this. From that point on, only single sips are encouraged. So they can take multiple sips to get the liquid out. But after the straw, only one. So straw number 4, straw number 5, more curved, a little more intricate than the others. There we go. And then I do, straw number 6 is my favorite. It's there we go, happy face. Kids love this one. Straw number 7, and I do not have straw number 8. And I believe there's only 8 straws in the therapy technique, the therapy hierarchy. The clients are to be taking these straws home daily and using them to drink all thin liquids. As they progress, thickened liquids and purees are introduced using specifically identified straws in the hierarchy. As each straw is mastered, the client moves on to the next. Okay, now slightly thickened liquids may be used if swallowing difficulties have been identified. So if a client is presenting signs and symptoms of aspiration with thin liquids and they're penetrating or aspirating, then they can use a slightly thickened liquid. The straw therapy can be used with clients who are developmentally normal with, say, an interdental lisp, or with clients who are diagnosed with cerebral palsy, Down syndrome, and etc. Depending on the diagnosis, treatment can last between 4 months to an even longer period of a year or more. The therapeutic straw treatments have proven to be effective with many standard speech sound productions. I will list all of them off. It has been proven to benefit the T sound, the D, L, N, the K sound, the G, the S, Z, CH, SH, the J, and the R sound. Even clients with velopharyngeal insufficiency, they also benefit from the straw therapy. It assists with increased evasive tongue retraction, it changes resonation, and elevation of the velum. Clients recovering from a cerebral vascular accident, known as the CVA, often exhibit lip asymmetry, such as a left or right facial droop, and weakness. Straw therapy drinking works to bring their lips to symmetrical midline, which improves speech clarity. Straw therapy is only to be used if the client does not demonstrate signs and symptoms of aspiration with the use of a straw. So sometimes after the stroke, the CVA, clients can show signs of aspiration or penetration, and we don't want them to use the straw. So we'll recommend that they take their liquid without it, but once their muscles improve spontaneously, and after doing some other oral motor exercises that don't involve the straw, then hopefully speech therapists can implement the straw to help strengthen those muscles. An extra advantage of straw therapy is that it can equally affect the client. An extra advantage of straw therapy is that it can be equally effective with clients, despite their level of cognitive abilities. The therapeutic results of tongue retraction and tongue grating for a client with severe cognitive impairment and limited or no language skills can be almost the same as with a developmentally normal child or adult. Straw therapy is an important tool to be utilized with all oral motor therapy activities, and speech language pathologists should research and look into doing this with their kids that are working on oral motor skills, articulation disorders, voice disorders, fluency disorders. It can really help all the mechanisms that are involved with speech production. That was 11 minutes. I'm going to go a little further. That was my presentation on straw therapy and a little insight into that and Sarah Rosenfeld-Johnson. But now I'd like to introduce another technique of hers that it's called the bubble blowing therapy technique, which many speech therapists do already, and it involves bubbles and the bubble wand. Bubble blowing therapy helps clients develop lip awareness as well as cause and effect awareness. One exercise of bubble therapy involves the speech therapist blowing a bubble and catching it on the wand. Next, the wand and bubble is held in front of the client's mouth and is popped on their lips. The client will probably close and pucker his or her lips automatically. Cause and effect. Another advanced step with bubble therapy is very similar to the first step. However, instead of having the client pop the bubble with the puckering of their lips, the bubble is held 1 inch in front of the client's mouth. Next, the therapist is to place his or her palm under the client's jaw with 4 fingers on one cheek and the thumb on the other cheek, pulling forward gently to help with jaw stability and lip rounding for blowing the bubble. 1 thumb on the cheek and the 4 fingers on a cheek, pulling forward to help with jaw stability and lip rounding gently. Eventually, the client will reach the final step and blow through the wand using a whispered woo position. The bubble blowing therapy not only helps with jaw stability and lip movement, it also helps the client develop adequate airflow for speech production. Woo. And so as the bubble gets further and further away, they need more air flow to produce that woo sound to pop the bubble. These oral motor techniques are beneficial for teaching articulatory awareness, placement, and strength, as well as muscle memory, leading to improved lip, tongue, soft palate, and jaw movement for speech clarity. Oral motor therapy techniques can be intertwined with other traditional therapies to help support the overall goals of the clients receiving speech therapy. I highly recommend researching Sarah Rosenfeld-Johnson. Google her. Talk Tools is is the first site that comes up with her name typed in Google. These are great oral motor techniques. There's a manual with the different oral motor therapy techniques, such as the horn blowing, the kazoo, bubble blowing, the gum chewing for the lips, the tongue, the base of tongue retraction, the jaw, everything. So that is it for now, and sorry I messed up in my video, but that's my presentation on oral motor therapy techniques and tools developed by Sarah Rosenfeld-Johnson. Once again, my name is Andrea Williams, and I appreciate you sitting here listening to my video. Thanks, and have a great day.